here in Newport for a practice called PPMA. Some of you over there, I know, has patients. And today we're going to talk about the art of aging well with a focus on staying sharp. So we're going to approach it from a few different angles. Okay, we're going to talk about the natural changes that our mind and our brain go through with time, with age. We're going to go a little bit into some of the biology behind that, not too much science class, I promise. And then we're going to talk a little bit about how we detect early signs of changes, things that might warrant some additional evaluation with a doctor or something like that. And most importantly, what I want to focus on today is focusing on things that you all can do now, today, and in the coming days and weeks, months, years, in order to keep yourself sharp and in good shape and to make sure that you are in your best mental peak. And then finally, we'll talk a little bit more about things that your physician can help you and be an additional consultant for you to help keep your brain sharp. Okay, so normal brain changes with age. There are some things that unfortunately are going to be somewhat inevitable that we, as time goes on, we have some changes, but they shouldn't be so much so that they are causing a major impact in your daily living. But some people do experience some changes in a little bit of extra time that is needed to learn new things. Sometimes people will find they have some difficulty multitasking or being involved in conversations that involve many different people in different parts of the room. It's also common for people to have a little bit more difficulty with episodic memory. That means things where you just visited someone and you're trying to remember exactly what they said in that one conversation that you were talking about. But generally, people's semantic memory stays intact. You should be able to still do your usual kind of skills and things that you've accumulated over the years. Some people will take a little bit of extra time to get oriented to a location, particularly if they're in some place that's new and they've been used to a single place that they say wake up in, and then they suddenly go and visit somewhere else, and it takes a little moment to recall what exactly led you to be where you are, but you shouldn't have any major difficulty getting oriented with a little bit of time to yourself. Every person's experience is different. There is a wide range of how our brain reacts to time and age. For some people, they're very lucky, their brain stays sharp all the way through. If anything, they seem like they're getting sharper with time. And then for some people, they'll have more gradual, progressive changes. And sometimes that can progress to the point that we have to start talking about evaluation and other types of interventions to try and address that. And we're going to get into that in a little bit. Okay, so the biology of the aging brain. Again, this is the science class part. I'm going to try and keep it very light and not get into too much detail about it. But there's a lot of parts of our physiology of our brain that play a role in how effective it is and that can change with time. And the first one up here is called neurotransmitters. Basically, within our brain are billions, if not trillions, of neurons that are all talking to each other. And each of them talk via a connection called a synapse. And what happens is one nerve gets stimulated and releases a chemical that the other one sees, and that sends the next signal, and that goes on over and over and over every moment of our lives forever. And what can happen is that we will have some decrease in those neurotransmitters. Issues with production and stimulation of their release can cause some slowing of the connections between our neurons. We also see that there can be some changes to brain volumes. Different parts of our brain play a role in different functions. The frontal lobe plays a role in executive function, being able to control ourselves and make higher order decisions. The temporal lobe plays a role in language and helps us communicate and understand other people as well. And the occipital lobe in the back is really important for visual spatial orientation, understanding where we are and how to navigate the world that we're in. What we can see is that some people will have a small amount of atrophy. Some people may have had MRIs or CT scans in the past that show that there may be some mild degree of atrophy of different regions of the brain. And some of that can be normal and can be expected. White matter changes. People have heard about gray matter and white matter. White matter is the part of our neurons that is responsible for sending the signal down one neuron from one end to the other. And if there are some changes to those, and they're composed of fatty acids, and we'll get into that a little bit later, but if those have some breakdown, then the speed of transmission in a given neuron is going to be slowed down, and again, that will have some impact on our function. And the last thing regarding the science stuff is our blood vessels. Obviously our brain requires blood, and not just a little bit, it actually requires a lot. It's one of the biggest consumers of oxygen and energy in our body. And so, it's working nonstop. It doesn't take a break like our leg muscles or something else, right? What can happen over time is that weakening of those vessels or changes oftentimes brought on by medical conditions such as hypertension, diabetes, smoking, can all have an effect on those blood vessels. It can weaken blood flow to certain parts of our brain. Okay, I think that's the end of all of the science there. Okay, so I just wanted to give a little bit of an idea so that when I talk later about what we're trying to accomplish with these changes in our life and what kind of things your doctor can help you with, you kind of understand a little bit of why we're doing that. Now, getting on to the early signs of dementia. Now, today I don't want to focus too much on full grade dementia, things like Alzheimer's or Parkinson's that we all hear about. I want to talk about things that I want you to be able to recognize and to start get a sense of, hey, maybe I should be talking to my doctor, getting some further evaluation, or at least making sure that I'm taking the right steps to protect myself if I'm seeing these changes. The term that we use for the early stages of not even dementia, even like a pre-dementia, is called mild cognitive impairment, MCI. And what that refers to is that step in between a normal brain, even a normally aging brain, and the steps to dementia. And so someone who falls in this category is showing some mild deficits in certain parts of our function mentally that may be a warning sign of some type of underlying dementia, or maybe a sign that there needs to be some environmental changes in order to protect the brain from further decline. Within mild cognitive impairment, many people have different domains affected. Having one part of your brain, moving in one direction and everything else being stable, suggests different medical processes than a different change. The most common type of mild cognitive impairment that we find is called amnestic. You might suppose that has to do with memory. So changes to our ability to recall events or other things that have happened can be a sign of mild cognitive impairment. But there are other things that can manifest as well, even in someone who has a pristine memory. So changes in executive function, language function, and visual spatial function. So executive function would mean our ability to do higher level thinking, to think through problems and plan actions based on that level of thought. Language would be our ability to find the words that we want to say, to understand what others are saying, and to be able to interact in that way. And then visual spatial would refer to our ability to stay oriented, both knowing where we are at a given place and time, but also recalling where we are, if we want to go somewhere else, if we want to leave the room and go to the restroom, do we know which paths to take there? Mild cognitive impairment is, again, it's this sort of intermediate term. And so a lot of things that might be normal for one person might still fall in the terminology of mild cognitive impairment. And as our brains change with time, more people, through natural changes and possibly some other additional environmental factors, will fall within that category. And so you can see here, I don't know if you can all read it, but we can describe the different rates of mild cognitive impairment. That rate is as high as 25% of people getting into their 80s. Now, it's worth noting, just because your doctor says you might have this terminology, mild cognitive impairment, it's very different being diagnosed with that in your 50s versus being diagnosed in your 80s, right? Someone who has it happen in the 80s has taken a long time to reach that point, and therefore it means that the rate of change is probably less. The chance of that progressing rapidly to something else is lower. And it doesn't mean that we can't take action and such to try and minimize any further change, but how much we should be evaluating and worrying and looking for an underlying cause and treatment and so forth is going to be different. So just because that number jumps up with age, I don't want you to think that it's all the same kind of thing. It depends. If you do get diagnosed with MCI, and the statistic here is a very broad kind of statistic. Like I was just saying, someone who gets diagnosed with MCI in their 80s is going to have a very different kind of prognosis than someone who gets diagnosed in their 50s. But on average, someone who has mild cognitive impairment will have about a 10% chance of progressing to the point of what we classically call dementia in a given year. The most common forms of dementia are Alzheimer's disease, Parkinson's disease, and vascular dementias, but there can be other categories or subcategories within that your doctor would help identify if that was a concern, something that needed to be acted upon.
What is vascular dementia?
Vascular dementia refers to certain changes within those blood vessels that I was describing earlier, to the point that it reduces blood flow to certain parts of the brain. So that can also include people who have a lot of strokes. A stroke doesn't just present as complete paralysis of one side of the body or the facial droop or all the things that we hear about. People can also have vascular dementia, where small strokes going on throughout the brain over many years accumulate to the point that our brain loses some of its robustness in performing other activities. So this one, I don't want to go into too much detail, it's just this slide here, but how do we detect mild cognitive impairment? The first thing is everything that I described before about certain changes is being able to recognize them within yourself, but also very importantly, having your doctor play a role in monitoring that. So for example, at my practice, it's fairly standard of practice for us that when a patient of ours hits around age 65, we start doing MCI screening. We perform a memory test, and that isn't just to try and identify something, it's also to get a trend, to get a baseline of where they stand and to see how that changes over time. If we have a patient who comes in at 65 and they're doing great, and then every year we see just a very, very slight decline, and at some point it falls under this MCI terminology, it's very different than someone who within a couple of years has a drastic decline. And we're going to approach that very differently. So a lot of this is going to be on having regular follow-up with your physician and making sure that you inquire with them, hey, what are we doing to watch out for my brain health, to keep an eye on it and to identify any changes. Okay, and again, this is the part of the talk that I really want to focus on that I think is going to be most impactful for all of you. What can we do right now to try and protect our brain health? And I'll be honest, there's no miracle cure that we have right now. There's nothing that, the one thing you can do, and if you do this for 5 minutes a day, nothing will happen. But it's a combination of factors. Like I was explaining before, in this biology, there's so many different aspects of our brain health that gets changed with time, with environmental factors, with medical conditions, and trying to protect it is really more of having an overall protective bubble around you with your behaviors rather than any single pinpointed activity. So first is exercise. This is incredibly important for your health, both mentally and physically, of course. In addition to all of the cardiovascular benefits, exercise helps to promote vascular health in your brain. You were asking about vascular dementia. One of the things that we can do to protect our blood vessels in our brain and minimize the chance of stroke or other types of changes there is going to be exercise. It also promotes regular blood flow, it lowers our blood pressure, which is protective. It has numerous benefits. And in addition, it doesn't just have that protective benefit, it has growth benefits. So being active regularly is going to promote neurogenesis, or the production of new nerves and neurons and connections, and also releases certain hormones that promote more robustness within our neural networks. One of the great things I love about being able to give this presentation at Vivante is that you all have so many resources at your disposal that makes all the things that I'm talking about right now substantially more accessible. The next one is a healthy, balanced diet, okay? And people talk about the Mediterranean diet. That's the fish, nuts, avoiding red meat, which I know from personal experience can be very painful for people, but trying to minimize it, maybe leave it for a special occasion. Try and have whole grain, instead of the processed grains. Try to eat more, vegetables and fruits. In addition, beyond the sort of broad idea of something like a Mediterranean diet, there are certain specific types of nutrients or vitamins that we like to encourage. One of those is antioxidants. People always talk about that. It's not always clear for people. It's not always explained why that's so important. When our body is growing with age, a lot of factors in the environment, from the sun, just from our body's natural process, produces these free radicals, which are sources of mutation, sources of stress. We call it oxidative stress on our cells. And by taking antioxidants, you add extra buffer for our body's ability to deal with those stressors before it has the chance to actually cause lasting damage. And being able to get ahead of that is valuable because as there is more damage, more of our cell's function is being diverted to try and handle the existing damage, and it minimizes its ability to deal with new sources of damage. The next thing is those omega-3 fatty acids. Again, this is where I talked about that biology. The white matter depends upon the presence of some fat. Our body uses fat to create what's called a myelin sheath around our cells, and that is the white matter. That is the connection between different neurons in our brain. And so having good omega-3 fatty acids, in addition to being an anti-inflammatory, also helps to promote the health and robustness of our white matter. Stimulating your brain. Much like any other muscle, a brain is a sort of use it and lose it or lose it scenario. Anything that you can do to try and stay active and learn new connections is very valuable. We often find that the patients who have what seems to be a more substantial change in their cognitive function at an older age are those who were incredibly active all their life in doing so many things. And the thing that's worth noting is those patients who have that experience of being really, really sharp and then suddenly things change would have been someone who actually showed signs much, much earlier if they weren't as active mentally as they were. Because what happens is they develop so many accessory neural networks, so many different ways to approach a single problem, that even if one pathway goes out, they have another one to fall back on. And then the only issue when that happens is then, possibly sometime in the future, if they have undiagnosed and untreated dementia, that it can progress to the point where even their last backup pathway is not able to keep up with the function, and then we see a great change. But the important thing is that it gives them so much more robustness and flexibility in all the years earlier when someone else might have already been showing all those signs, all those changes. They're able to protect themselves with it by being active. So I encourage people to always seek out new activities. I know there's always an activity list here at Vivante or other hobbies, reading. One thing that we have a little handout for is some applications that you can get on your phone for iOS or Android that have some games and stuff that you can do that try to challenge different domains. I talked about those domains of our brain that can be affected in mild cognitive impairment, and these apps try to target each of those domains separately so that we can build extra pathways to address each of them. Here are some of those apps. Again, I won't stay here too long. If you would like to have a list of them, we have a handout in back. Okay, next up is sleep. Not too surprising that I'm sure we all understand that sleep is incredibly valuable, but it is, I just wanted to emphasize that it is important. It's not just about the length of sleep, although of course that matters. It's also about the quality of sleep. So if anyone has diagnosed sleep apnea, even if it's not quite affecting you on a day-to-day energy standpoint, it can have numerous effects on your health, including your brain. It can affect our ability to get quality sleep and get into that deep REM sleep that's so important for clearing out toxins in our brain, some of the things such as beta amyloid, which can contribute to Alzheimer's disease. It also can be important for controlling our blood pressure. If you have sleep apnea or you don't get high quality sleep, you can have elevated blood pressures, and that can contribute to the vascular dementias that we talked about. So again, try to shoot for 7 to 8.5 hours sleep. We find that too much less or too much more than that can be a sign. And it's not that too much sleep is inherently a bad thing, but if someone is needing that much sleep, it may raise the question about their sleep quality. Social interaction, again, another great thing that I like about Vivante here is so many people around each other able to interact. Social interaction, in some ways it kind of is like that new activities. Social interaction is so engaging. We are acting with language, we are showing higher order function, we're perceiving other people and having to assess them and interact with them, and they might bring up new things that trigger new pathways in our brain to form. And so just having that sort of social interaction is very protective. So lastly, this is only a sort of secondary aspect of this talk, but what can you do beyond that? What can you do both for protective measures with your doctor, and also how can they help you if there are signs that more intervention is needed? So, like I said, I think that a very crucial part of a doctor's role in this whole field is being able to prevent and identify. So early identification of any cognitive changes is incredibly important, and that starts with getting a baseline. That means having a doctor who will check the MCI screen or other similar metrics in order to get a sense of your cognitive status, and then checks it over time so that we can see if there's any change. I have some patients who come in and a couple of years later they're actually performing better. That's great news. I'm always happy to see that. Some patients will stay steady and some will have some gradual changes, and some, and the ones that I have to be most attentive to, will have more substantial changes from year to year. And in that situation, you want to have a doctor who's paying close attention to that so that they can discuss what can be done. In addition, they said, of course, doctors like medications. We sometimes will prescribe medications. In addition to that, at least I believe that food is medicine. We have a nutrition services. I'm sure many other doctors do as well, but having someone who can hook you up with nutrition services in order to talk more about the details, not just about your brain health and the things that I just spoke about, but also going into detail about certain nutritional choices that might involve other medical conditions you have, like diabetes, like hypertension, that can then have downstream benefits for your mental health. Oh, the one last thing is, and there may be some role, it's still very early in terms of research. Anyone who tries to sell that a certain supplement is an absolute cure-all, I don't personally believe that at this point. There hasn't been anything that's shown itself to be an absolute, but there are a lot of promising supplements and nutritional options that can have some benefits for mental health. And so having, again, someone to talk with you about that and take into account your other medical conditions is important. So to summarize, some changes with age are normal, but if you have any signs that it's going more than what you expect, you're finding yourself not being able to be involved in activities that you normally want to be involved in cognitively, then that's when you want to talk with your doctor, make sure you're having close monitoring, discussing early interventions, both in terms of lifestyle and possibly medications or other activities. That there's a lot of things that you can do in your life today, in the coming days and months and so on, to try and protect your health and protect your brain and put it in the best situation for the future. And just making sure that you work closely with your doctor to keep all of the other things that might contribute and be an environmental factor in your cognitive health under control. Thank you. Did I see any questions?
On the one that said doctor, what your doctor can do, you said something about he or she can prescribe medicine. What, I didn't know that there were medicines for MCI.
For NCI, it depends, and it depends on the suspicion. We have some medications that show some benefit symptomatically and some medications that show some benefit potentially with slowing progression, particularly in the range of Alzheimer's disease. Memantine and donepezil are commonly prescribed ones when that is a concern or a suspicion, and that's one of the medications.
I see, okay.
Yes?
What is your position? You said PPMA?
Yes, PPMA, we're a concierge physician group here in Newport. It stands for Private Physicians Medical Associates.
So if someone notices or suspects some of the things you talked about today, is that then time to come in and see your office?
Of course, I would be happy to see anyone who has concerns, and if you feel for some reason that you don't have a doctor that you're seeing, or you want to have someone who's maybe a little bit more involved with doing close monitoring, of course, we're always happy to be a part of that conversation. Yes, and we do MCI screens as part of our standard.
Where are you located?
We're located in Newport Beach on Superior Avenue near the Hoag Clinics. We're in the Hoag Clinic building. Any other questions? All right. Thank you very much, everyone. I really appreciate you coming.